Well, good morning. Thanks for joining us on Shop South Mississippi. We're talking with Ann at Gulfport Behavioral Health System. How are you?
I'm good, Chet. How are you?
I'm good. Thanks for being with us. So,
Absolutely.
She's the director of nursing here at Gulfport Behavioral, and so I say that because you've been in healthcare. You've been a healthcare worker for a while now, and I think it's important to note that it doesn't matter where you are, it doesn't matter where you go. There's a healthcare worker shortage everywhere, and that just means that those individuals who are working are sometimes pulling 1.5 times their weight, 2 times their weight, and they're dealing with situations where individuals are in crises, and they're having to deal with that individual's situation, and it's impacting them whether they know it or not. They're just compartmentalizing it, right? So suffice it to say, medical professionals, healthcare workers need the services that you offer here at Gulfport Behavioral Health System just as much as anyone else.
Absolutely.
Tell us about that.
Well, first of all, this is one thing that's very near and dear to my heart. I'm very passionate about being a healthcare worker, but not only being a healthcare worker, but overseeing healthcare workers in general.
Those frontline individuals.
It's frontline individuals. It's a very important job, and what they do is very important. I think it takes a very special person to do that.
I think you would say it's a calling.
100% a calling.
You don't just wake up and say, I'm gonna be a
definitely a
nurse.
calling. I mean, it's it can be tough at times, right?
Yeah.
So you have to love what you do, or else we wouldn't do it.
Sure.
That being said, a lot of times I feel like healthcare workers put themselves, to the side or put themselves on the back burner so that we can effectively take care of others, right? Like we put our needs to the side. And sometimes that can catch up with us. And it's hard for us to acknowledge when it does, and hard for us to acknowledge those feelings because we're so used to helping other people and guiding other people, through their hardships and whatnot, that we forget to take care of
part of your DNA.
ourselves. And a lot of times it takes somebody else to tell us to stop and to take care of yourself, because we're so used to being others focused and helping everybody else that we tend to forget about ourselves.
Sure, and listen, when you're a healthcare worker, you're dealing with not only helping those individuals in a moment of crisis, but you're dealing with the administrative side of being a healthcare worker. But then when you're done, you're leaving the office, getting in the car, and putting on a completely different hat. Now you're a mom or a dad or a brother or a sister, and you go to family, and it's a whole different setup.
Right.
And that might not necessarily be the individuals that you can seek help from because of what you've experienced throughout the course of the day.
Yeah, I mean, you bring up a very good point. A lot of times we as healthcare workers leave work and we get in our cars and you got to switch gears, right?
Sure.
Like your next job is to a different audience, different patients with different needs. So you might be switching gears and switching places that you are, but your whole approach to taking care of somebody is still going to be the same. So your needs are still going to be placed to the side so you can do your job and take care of other people as well. So I don't know if you're ever really done.
And that,
you kind of just clock out and then clock back in
that's
to
right.
another job.
You just don't clock out. It's just a different. It's just a different payroll.
Different pay period now.
So but that kind of lends itself to the culture here at Gulfport Behavioral Health System, and that you're here in the service of others, and you, as the director of nursing, you're in charge of those frontline folks.
I am. I take that job very seriously. It's something I put really, or one of my priorities is for my employees to, number one, take care of yourselves.
Sure.
Like I said earlier, sometimes it really takes somebody else telling you to stop and take care of yourself because we're so used to being others oriented and taking care of other people that we forget to stop and ask ourselves, are we okay? So I think it's really important that our employees have the right, mindset and that they're taking care of themselves in order for them to actually create an environment where we can effectively help others. To the best of our ability. We want to create that environment where our patients feel safe and they feel respected and they feel supported so that they can begin a process through whatever they're processing. And in doing that, we help them and we give them the tools to, when they leave here, they can go and tackle life's, difficulties or obstacles.
Absolutely. Perfect. Thanks, Ann.
Thank you.
We're now joined by Antoine. Thanks for being with us today. How are you?
I'm doing well. How are you?
I'm well. So we're going to talk right now about the substance abuse treatment program. And everybody, regardless of whether you're directly or indirectly impacted, has known someone or has close to someone that has had some kind of substance abuse challenge. So tell us about the program here.
Yeah, so I'm very much passionate about where I work here at Gulfport Behavioral Health. As a business development representative, I have the opportunity to explain to people their resources. So we have a 24-hour assessment line where someone can call in a crisis, and then from there we have a detox program, we have intensive outpatient, we also have partial hospitalization.
So are these programs that you can, that maybe situations with individuals, they can't afford programs like this, but they need the help? Are there ways that you can help fund that, or are there programs outside of here that you utilize as a partner to help fund programs like this?
Yes, we do have a lot of community partners around the Gulf Coast. If someone calls and they do not meet the criteria to become a patient, we always give them resources that they can use outside of GBH.
What about those individuals who are watching? And it might not be the individual who's having the challenge right now, but it may be a family member of an individual that they think may be going through a challenge. What do you say to those folks that would let them know this is the time to call?
Whenever a person notices something that an individual may have been doing during social time, is becoming a regular day occurrence. Whenever someone needs to use a substance to affect their mood or to get by daily, that's the time to call. Try not to wait until the water's above the head. Start noticing when the water's at your ankles. Reach out, talk to the person, be a friend, just have a casual conversation to check in with them. Sometimes it's too late and you wish you had that opportunity to speak. The opportunity is always to speak right now.
What if you don't know if someone's having a substance abuse challenge, and what are some of the symptoms that you would see from that loved one or that family member that would let you know maybe this is a problem?
Changes in their characteristics. So if they're a talkative person, they're always checking in, they're always going out, socializing. Sometimes people turn inwards. Say for instance, you notice that you have a brother or a cousin that always has a beer in their hand. Mm-hmm. At a certain point, you want them to put that beer down. Whenever things are making you uncomfortable about a loved one, that is the time that you should check in.
Because if it's uncomfortable for you, it's likely uncomfortable for others.
Absolutely.
Yeah.
One thing that I would like to add is that each patient here is given a confidential plan while they're here, as well as a plan when they discharge, to make sure that we follow all levels of care while they're inpatient and outpatient.
So I think the point to take out of this is that there's never a problem calling and asking questions. If you're concerned, then there's probably a reason to be concerned.
Absolutely.
Yeah, and so you see that information there at the bottom of your screen. Gulfport Behavioral Health System, right here on Highway 49 in Gulfport. You see that phone number. They're having a complete intake and assessment program where you can get your questions answered 24 hours a day, 7 days a week, 365 days a year. They'll be able to help you out. They'll be able to help your loved ones out and get you on the right path before it gets to that water over your head kind of situation that Antoine talked about. So definitely give them a call. They're here to help you, and they're here to help anyone that any of your loved ones or your family members. They're going to get you on the right path. Antoine, thank you so much for being here.
Thank you so much.
Absolutely.
All right.